Good afternoon. Today's session will focus on a topic largely into psychoanalysis. Title of today's talk is Calendar Climax. Calendar climax is not an academic term in psychoanalysis. It is a term that I have coined. It is a term that has come to me from practice. It is something that every practitioner comes across, but we are not able to usually conceptualize that into a concept and then use our experience for giving more relief, more cure, more preventive, more curative to the client. It is a new concept, rather a new term that I have coined. Let us go into this term first to know what it is about, why is it so necessary, and if we coin this concept, how does it help us in concept and in practice? As the word suggests, the phrase has two words, calendar and climax. Calendar refers to something that is related to time, something related to date, and something that is predictable and reoccurring. And climax refers to an episode, mostly an acute episode, which is sort of a climax of an ongoing unconscious process, which has been going on at a low intensity for a long time and climaxes at a particular time. And that particular time is not random. It is according to a pattern. There is a meaning to the climax occurring only at a particular day, date, and time. And therefore, the occurrence of the episode is not random. It is not because of some contingent factors. It is out of a predictable pattern which is linked to a calendar, and therefore the term calendar climax. Most of the times we are referring here either to a chronic pathology which continues at a low intensity and climaxes on occasions, and some of those occasions may be contingent and some of those occasions may be predictable according to a calendar pattern. So that group of episodes where the upsurge is based upon a calendar pattern, we can term those episodes as calendar climax. Rather, those episodes are based upon the phenomena of calendar climax. They climax according to a calendar. Point is not that this is all there is to it, that every episode is predictable, linked to a calendar. Of course, that is not the contention. The point is, of many groups of phenomena, one group is where the episode climaxes according to a calendar. And that is what makes it situated, located in a pattern, in a temporal pattern linked to a calendar. And we will see by calendar we mean not only a date, it can mean many things, both subjective and objective, both personal and collective. However, the core is that the episode happens according to a temporal pattern, and therefore the word calendar climax. So here we refer largely to two sets of pathologies. One, long-term chronic pathology, occasionally climaxing. And second, that group of pathology where we don't see a chronic pattern, we only see an episode climaxing suddenly owing to something related to the calendar. So only occasional episode sicknesses and long-term chronic sicknesses. In that context, we understand and use this word. Let's enter into our discussion. What is calendar climax and why should it happen and how do we see it in practice? Let us first understand the what. Why we'll take up slightly later, especially in the context of psychoanalysis. When we use the word calendar climax, we essentially refer to a time-related pattern in psychological sickness. And this is not new. We have seen time-related patterns in psychological sickness for a long time. Take, for example, seasonality, winter depression, seasonal depression. Take, for example, psychosomatic sicknesses which worsen during the change of season. Take asthma or take any skin allergy. So seasonality already has been known to be a factor in psychological sickness. So we see with the onset of winter, certain forms of depression they climax. And we see two patterns. In certain groups, these winter depressions happen only with the onset of winter and then go away. In certain cases, they endure during winter. And in certain cases, the depression is across the year, but it worsens, it climaxes once more because of the seasonal change. Same is true of psychosomatic sicknesses like asthma, where seasonality is a very strong element. Any allergy-related autoimmune disorder, usually they go worse during the change of the season. There will be one group of people who have heightened anxiety when the season changes. So the seasonality, the natural seasons, the natural season calendar affecting psychological sickness, precipitating certain sicknesses, precipitating episodes in certain sicknesses, making ongoing chronic sickness undergo an acute episode, that calendar-oriented change of season phenomena already has been known, both in biological medicine and in psychological sickness. The calendar climax or the temporal patterns are more seen in chronic sickness, where the sickness is going on across the year, but whenever a particular season arrives or a change of season happens, the chronic sickness undergoes an acute climaxing episode. In some cases, we don't have a chronic sickness, but we only have acute episodes in particular seasons or particular season change. This climaxing of sickness can also be seen when one is undergoing significant events in life. like a change of school, change of home, marriage or job, any significant event in life, these points in life, they become high sensitivity points for onset of sickness. A very large proportion of sicknesses make their appearance and go. Some make their appearance and stay during these important calendar events of life. These are very important predictable calendar events of life. Many sicknesses reoccur at very predictable intervals, fixed or variable. The calendar climaxing can also be seen on certain significant days. On some day, if a person has experienced a severe loss, say the death of the mother, or humiliation in public, or very intense humiliation, or an attack by somebody, physical or psychological, some shock, some trauma, maybe it was the last day of college and everyone was going back to their home, and on the bus stand or railway station or airport, you are seeing off everybody, you're seeing them for the last time. You are vacating the hostel and saying goodbye to the room you have stayed in for a long time and saying goodbye to all your friends. So those significant days can be the days where the conscious mind may not recollect, but the unconscious mind can create a climax. There can be a calendar climax phenomena in festivals, that whenever a particular festival occurs, there is a crisis and there is a spike in social anxiety, there is a spike in irritation and anger, there is a spike in sickness, there is a spike in psychosomatic symptoms. Some people have to fight and spoil the festival. They have to fight and spoil a marriage party. Very predictable. Wherever they go, they repeat it. So it's a calendar climax phenomenon. Something very predictable according to a calendar event. One group of clients have this phenomena of quarterly sickness, psychosomatic. Not exactly mathematically accurate quarterly, at times 3 months, at times 4 months, at times 5 months, but as a term I have put here quarterly sickness. That once in 3 months, they have to see a doctor or they have to get admitted to a hospital at least for a day. Usually it is 2 days and then they go back home. I have seen this quite sometimes when working with low income slum communities in India, where the life is so hard, particularly for women, married women, that there is no respite, no relief. The weather in India is so difficult. The living conditions are so difficult. Financial crisis, health crisis is so difficult that the only time that they get to go back to reverie, to be a child, to be cared for, to get some rest and respite is when they fall sick. And I met many of them who almost once in 2 to 3 months fall sick, get admitted for 2 days. That is the only time they feel looked after, cared, where they can have rest and relief. Some relief from the unbearable every day. That is the only way they can maintain their sanity. I call this the quarterly sickness. And they say it also that not in such an explicit way, but they say I have to get admitted once in 3 months. And after the only that I feel good and I can go back and continue with my life. Within 3 months, it just becomes too much. I can't contain it anymore. And I get sick and I have to get admitted. So this is a quarterly sickness, a calendar event, very predictable for that group. One group has a climaxing of psychological issues or psychosomatic issues on their birthday, on the day of their marriage anniversary, or on the day of death of someone. Often, birthday reminds you of those people who are no longer with you. Birthday can also remind you of your failure in life. Birthday can also remind you about the sadness that life, much of the life is gone. It's all over now. And the unfulfilled desires are going to remain unfulfilled. Especially after the middle age, birthdays become more difficult. So for a group of people, birthdays see this phenomena of calendar climax. Increase in psychological difficulties, increase in psychosomatic sickness if it is there. Calendar climaxing can also be seen if there has been end of a relationship, a divorce, or end of a very deep relationship. Whenever that day comes, something happens, the person is not able to make out, but the unconscious mind remembers the calendar. The conscious mind doesn't remember the calendar, but the unconscious mind remembers the calendar. There can be a climaxing on some particular day of a political or a social event also. Political event in the Indian context, we can think of partition 1947, very traumatic. The war of 1962 with China. We still have people, soldiers with PTSD, and some of them have videos recorded on YouTube where they say on those particular 3 days when they were fighting, something happens to them and they just, everyone around them tells them that on these 3 days you just go crazy. And now it is 2022 and the video I think is about 2002 or 2012. So even after so many years, people still remember that traumatic event. The unconscious mind and the body remembers, keeps the calendar. Without any fail, without any mistake, it keeps the calendar. Similarly, citizens in Pakistan would remember 1971 as a traumatic event of dismemberment of Pakistan. And those in Bangladesh would remember the traumas of pre-1971 on the day of independence of Bangladesh. Season changes are also those occasions when calendar climaxing maximizes. We see in season changes, those with psychological difficulties, but more even than that, those with psychosomatic disorders and conversion disorders, autoimmune disorders, they see a peak during season changes. And we can know it in a very predictable way, and therefore we can prepare to manage it better. The whole idea of the concept of calendar climaxing is to know the calendar of suffering of a client and take both preventive and curative measures and be prepared so that the suffering is minimized and long-term healing can happen. Ultimately, the goal should be to free the person from the calendar climaxing and pathology per se. Where do we see calendar climaxing manifesting itself explicitly in pathology? If we take up DSM, in which disorders do we see calendar climax phenomena explicitly at work? First, PTSD. In post-traumatic disorders, the unconscious mind remembers the calendar. And years after the trauma, on those particular dates or that particular time, episodes climax. So PTSD is the post-traumatic stress disorder is one category of pathology where the calendar climaxing is very explicitly seen. We can talk about the Second World War, soldiers of First World War, Second World War, soldiers of Vietnam War, soldiers of Iran-Iraq War, Hindus who suffered in 1947 partition of India, Indian soldiers who fought in 1962 war with China, Bangladeshi citizens who suffered in 1971 because of genocide perpetrated by the Pakistan army. We can also see PTSD in more individual context where some family member or a criminal has perpetrated a trauma on some innocent victim, mostly a child, and the body that remembers for a long time the calendar. Second category of psychological sickness is depression. We can see it's worsening in winter in a group of patients, and it's worsening during season change in another group of patients. Why it happens this way, we'll see later. Anxiety we can see worsening in winter in a group and during season change in another group. And of course, there can be a group where it worsens in both season change and in winter. In a small group of conversion disorder patients, we can also see calendar climaxing, where the conversion was more intense, more acute on certain calendar dates or calendar events. Psychosomatic sicknesses, often they go worse on some special occasions like birthdays or festivals or somebody else's birthday or anniversary, or on a social festival, say Diwali or Holi. On some day that is related to the death of a parent, death of a friend, death of a near one, or something related to separating from somebody very close to you. And we can see in non-chronic sicknesses, recurrent predictable episodes happening during onset of winter or during season change. So we can see calendar climax as a phenomenon at work in all these categories of psychological sickness. In fact, I believe that if you explore all the chapters of DSM, you will find far more occasions and many other categories where you will see the calendar climaxing phenomena. I feel quite surely that in the category of addiction and in the category of personality disorder, we will explicitly and vividly see this phenomena of calendar climax. Now let us come to why it happens. The why and how, the process knowledge of calendar climaxing. Why would it happen? As we saw, there are two manifestations of this phenomena from a pathological standpoint. One, something activates based upon some calendar event, a non-chronic situation. And second, something chronic becomes acute and climaxes according to a calendar event, be it a date or a social occasion or one's birthday or whatever be the calendar event. Psychoanalysis tells us in process terms, in terms of pathogenesis, somehow that calendar event is linked to activation of unconscious traumatic memories. And the unconscious mind and the body keeps a clock, it keeps the calendar. So whenever that date or that festival or that occasion happens, those traumatic memories are activated. Negative effects like anxiety, loss, envy, shame, guilt, pain, they are activated. And it is this unconscious activation of the negative effects that is largely responsible for the climaxing phenomenon. A very important realization also comes for a large group of people who experience calendar climaxing when some calendar event tells them it's all over. What had to happen has happened. Life is done, it's over now. This is particularly true after midlife. And this happens largely on calendar events related to the birthdays after the midlife, related to children getting married, grandchildren coming in, or children getting into a job, or people telling you now you are aging, age is taking over, it's showing on you. Or a sickness comes because of age and you realize that mortality is a fact now. Often parents go sick or parents die across this period of the mid-age crisis. And therefore, thereafter, events like birthdays, children getting into job, children getting married, grandchildren coming in, somebody telling you how good it was and now it's all over. Meeting old friends, realizing all that had to happen has happened. And this very deep feeling, it's all over, it's done now, that often sets in a deep sense of disappointment and resignation and a huge amount of sadness, which, if not catharted out, creates this climaxing. Now, the activation of this climaxing can happen out of three causes. One, the climaxing can happen just because of the date. That on a particular date, something happened. Maybe the mother died, or I left the college, or I was humiliated, something happened. So the moment, or I fought a war and I got traumatized. So the moment that date comes, the unconscious, unprocessed feelings are activated and the climaxing happens. And most of the times, the person is unaware of the real unconscious event. All he can see is the conscious manifestation of that event, which is pathological. So the process of activation of the process of climaxing can be a date dynamic process. Dynamic can be date oriented, or the dynamic can be event oriented. That you might celebrate your birthday according to the Hindu calendar, and that will mean the date shifts every year. Yet on every birthday, the climaxing happens. Or the climaxing can happen every time you have to go to a marriage party. Or the climaxing can happen every year when the festival of Diwali comes, and it comes on different dates every year. So there can be an event related dynamic that the event sets off the climaxing. Or there can be an energy dynamic that during season changes or during low temperatures or certain season changes or certain weather patterns, high amount of energy is generated in the body, which energizes more everything, including the unconscious complexes. So this energy dynamic, which is not related, this energy dynamic, which is not related to the content of any event, can also set off the climax. The climaxing can happen also because of relief surge. Every day is too much to bear and the person wants relief. The everyday suffering goes beyond the affect tolerance capacity. And often the person has to be admitted to the hospital where he can take rest. Or the person has to go and visit a doctor to re-establish the omnipotent object inside, especially for that group who have not internalized a good, reliable, stable object. They have to see some healer, either an allopathic doctor or a pranic healer or a Reiki healer or a homeopath or somebody. But they have to see somebody who they can think of unconsciously, of course, as a good, reliable, stable, omnipotent object that has to be internalized because the system does not have capacity to internalize an omnipotent object forever. The omnipotent object internalized has a shelf life. It erodes over time. And the moment the erosion is complete or substantially done, the need for an omnipotent object arises, and one has to physically get in touch with the omnipotent object to re-establish and re-internalize the good, reliable, stable object. What Kohut calls transmuting internalization, the system is not capable of that transmuting internalization. Climaxing can also happen because of excess of innate response strategies. This is a word used by a Stanford professor. I don't recollect his name. It's not my phrase. His phrase. Idea is that every pathology is actually an exaggeration of an otherwise normal response. That there are innate response strategies evolved over evolution for our survival, growth, and adaptation. And when these innate response strategies, they exaggerate, they go on the hyper or hypo mode. So they become too much or too less. They are not in the optimum zone. That is where pathology comes about. So in evolutionary terms, we were always afraid of darkness. We were always afraid of rains, because that is where it's easier for carnivores to hunt us down. These things also bring in a lot of sickness. This can also bring a lot of insect bites that you cannot see in darkness. So rains and darkness are associated with fear, anxiety. And if this innate response strategies misfire in an exaggerated way, we can see a climaxing thing, that every time it is dark clouds and rains, there is a surge of anxiety. There can be a climaxing problem because of something genetic also, that genetically one is so structured that one gives an allergic reaction, say for example to pollen, when there is intense sunlight after rains and the pollens are high in the atmosphere. So there can be, this is one example, there can be other situations also, but there can be a genetic predisposition to acting in a, to responding to a particular calendar event, which is more seasonal in nature, with exaggerated response, creating a pathological problem. In chronic sickness, we generally see a calendar, that it goes on at a regular intensity and then peaks at certain points in the calendar. And it's very necessary to find out when the peaks happen. And this chronic sickness can be personality disorders, addiction, depression, anxiety, obsessions, but most importantly, psychosomatic sicknesses, conversions. Once, because we realize that there is a calendar at work, it brings in an element of predictability. It brings an element of understanding from a psychoanalytic standpoint, also from a psychiatric standpoint. And because there is an element of predictability and a clear direction, which gives us a clue about causality, preventive and curative both measures can be taken. So in therapy, we can look at preventive measures, curative measures, because we know we are nearing a date where this is likely to happen, or we are nearing an event where this is likely to happen. And in moderate to long-term therapy, it can easily be done, because the first 2 times it happens, we know a calendar climaxing phenomena is at work. And the next time such an event is scheduled, we can look at preventive and curative aspects of therapy. Those who are taking drugs can also keep medicines ready with them, meet a psychiatrist before such an event. Always keep ready the stock of medication, preventive and curative both. Exercise lifestyle caution in terms of food, sleep, activity, and if you know holistic healing, do more of it, especially for preventive and also for curative. And if you know somebody who can do it to you, maybe pranic healing, Reiki, do more of it when you know it is likely to happen. So there is a preventive aspect and of course the curative aspect, because you know that these are the causes and very deeply entrenched. You keep working on the causes across the year, but you do more of it when the event actually is scheduled. The annual healing plan can be created in the light of factoring in the light of many factors. One of the factors you factor in is the factor of calendar climax. And if we have this annual plan and if we keep modifying for chronic sicknesses, the management is much better. How do we heal? What is the way out in healing in psychoanalysis? If we realize calendar climaxing is at work, first it is to revisit the trauma. That original trauma which has now created a calendar for itself. Analyze it cognitively. Go for release of feelings, the catharsis. And we can use a variety of techniques here, including art therapy, ISTDP, emotion-centered therapy, group meditations, workshops, affect-centered workshops, say anger-centered workshop, say anger workshop or pain workshop. A deep mourning is necessary if one has passed the midlife crisis. And if the problem is, as we said, we discussed, it's all over. It requires very deep mourning and a very profound acceptance of reality. So after midlife, it requires a very deep mourning and a very deep and profound acceptance of reality. Internalization of silence and peace of the therapy room. Therapy should not be where the patient or the therapist constantly is filling up the silence with words. There should be durations of silence, of peace, where none of them is talking and there is a happy peace, not the peace of anger, not the peace of anxiety, but a happy, stable peace, healthy silence. And that healthy peace and silence of the room has to be internalized by the patient. So he creates inside of him a, a quiet place, a quiet space, and as Dr. Gargiulo calls it. He internalizes and creates inside a silent space, a peaceful space, a blissful space to which he can go back to. In some patients, internalization of the good object has to happen if this calendar climaxing has to stop. Without that internalization, they are not able to bring out the fundamental core negative effects trapped in that traumatic memory. If you try to pull it up by force, it's too much of anxiety, too much of rage, too much of disintegration, and in all probability, they will either get worse or leave the therapy. A very important element is the creation of the idea of good life. A good goal not only provides clarity, it also provides happiness, it also provides motivation, also provides ego strength, and the good life idea becomes a good object which gets internalized. Involvement in social work, which gives deep satisfaction, genuine happiness, is a very salutary and healthy measure which can help us in this healing. Superego satisfaction, superego happiness, superego strength, superego health is something we have not discussed enough. We talk about superego pathology. We don't talk about superego health, superego happiness, or superego power, or superego healing. All of that is at work when you do good to others. Spirituality is a very profound engagement which helps us in this situation. Spiritual practices, spiritual beliefs, spiritual philosophy, spiritual lifestyle, perhaps a good guru, a basket full of spiritual tools. It helps in healing. Usually not tapped into by psychoanalysis, but healers more with a holistic background can tap into spirituality and social work. How can holistic healing and spirituality help us here? In holistic healing, we find techniques and tools, schools and methods, a basket full of them for both preventive and curative. We can use pranic healing, Reiki, homeopathy, naturopathy also for both preventive and curative. Prevent the scheduled difficulty, the scheduled episode, and work on the causes of it in a sustained way, focusing on trauma and the trapped memories, trapped affect, and weaken it over a period of time, the whole traumatic constellation, with a focus to finally heal it. Spirituality helps us, it gives meaning to everything, including our suffering and trauma. It explains it by concepts of karma and self journey, and that certain suffering is because of acceleration of our spiritual evolution. And because of self journey, we wanted to experience certain things. So it provides meaning, to locate suffering in a meaningful context, in a purposeful context, in a rational context. Stops us from beating up ourselves. Why has it happened only to me? Locating our suffering in a purposeful, rational context is a great relief. It is a great healing that starts in a small way. We take responsibility, we resolve to heal, and we see purpose in the whole endeavor, which is very important. A purpose towards a positive goal. And the positive goal more than compensates for all our suffering. Invites us to reach the positive goal. Spirituality talks about happiness, light, and celebration being the foundation of existence. Spirituality tells us our suffering is on the surface and transitional. It is an exception, not the rule. Quite the opposite to what Freud would say. That goal of psychoanalysis is to make a transition from unbearable unhappiness to bearable unhappiness. Spirituality is very positive, not pessimistic like Freud. Rule here is celebration. That at the core of our being, at the core of existence, and the final goal of all individuals and the whole of creation is celebration. So all of it is worth it. It's a profitable enterprise. It rehabilitates us, gives us energy, positivity, a good goal, happiness, and something to look forward to. We don't feel it's all done, it's all over. There is no resignation from life. Spirituality also has a basket full of techniques and tools, approaches of idol therapy, which is a very vast science, using visualization, idol, mantra, spiritual rituals and practices, use of mantra, use of meditation, and use of certain herbal substances in certain rituals as a part of a larger package created for the individual. So holistic healing and spirituality both have schools, techniques, tools, a basket full of them to offer to enable us heal calendar climax. Thank you.